Honorable Minister of Health, Honorable Hamid Lamin Samate, and the entire senior management of the ministry, and the entire National Health Emergency Committee. On their behalf, I'm reading this statement. First, I will start with the highlights as to what is happening. The Gambia, if you can remember, recorded its first confirmed COVID-19 case on the 17th of March, 2020. The patient is in isolation and clinically stable under excellent care at the MRC clinic in Fajara. Currently, we have no new case, and as since the reported case, the index case was reported, we don't have any new case at the moment. We also have on the ground 20 surveillance officers who are trained, and they are currently helping us on the contact tracing, and as well as also they also been trained on standard operating procedures as part of their work in tracing the contacts. We also have over 30 staff of the Kanifing General Hospital who have been trained on infection control and prevention. And we also have pledges by some individuals who really want to support the response efforts. And also we are also having a systematic contact tracing also started. It began in earnest, and also contacts also have been line listed so far, and they've also been categorized. Travelers who also arrive from hotspot countries, which have also been highlighted before, are being quarantined for 14 days. This is mandatory, and there is no compromise with that. And in this quarantine, the government is providing accommodation free. The government is also providing food and water free, and also providing security, as well as also providing medical care, giving them medical personnel. So I think this is what the government is doing, and it's part of the quarantine, procedures, and we are also fulfilling, at the part of the government, we are also doing those ones. Going to the case history of the case we had, I want to give you just some little bit of information about that. The case of patient, as been reported before, they say 21-year-old. It is not a 21-year-old lady. It is a 28-year-old female Gambian who is a resident of Western One Health Region. Kind of, as you know, we have 7 health regions, and this area where we are is the Western One Health Region, and also Western 2 is Brikama. You have Lower River Region, Central River Region, Upper River Region, North Bank East, and North Bank West. These are the health regions. It's a Gambian. And on the 9th of March, 2020, the case traveled to the UK on official duty. She returned to the Gambia on the 15th of March, 2020 via Royal Air Maroc, 8579 at about 1:49 a.m. Onset of symptoms began with fever, and that was on the 16th of March, and she also sought self-referral to MRC Gambia for testing on the same day. Sample was collected and tested at MRC Gambia laboratories. A positive test result was received at 6 p.m. On 17th of March 2020. This is the first confirmed case reported in the Gambia since the beginning of the pandemic in China in December 2019. Since self-reporting at MRC, the case had been isolated. Contact identification, contacts were identified, listing and monitoring of comments also started, and also the National Public Health Emergency declared and WHO notified. Then we had the case, we had to contact, we also have to do what we are supposed to do, monitor, and also a National Public Health Emergency declared to say the case is available, and also WHO had been notified, and that's the procedure, and that was also done. Going to the next level of the public health actions in isolating the confirmed case, we also have various interventions that have been done. For example, at the level of coordination, we also had coordination meetings that were held. We also had an incident action plan modified to reflect the current the realities on the ground. And then IT department, we were also told to consider creating a virtual platform for coordinating meetings. Travel restrictions approved by the National Assembly for immediate implementation. Passengers from hotspot countries to be subjected to mandatory quarantine. Executive directives also given for the suspension of flights from Not even 13 countries now, but about almost 43 countries that are also in hotspot countries, according to the new list that also came out. So going to the epidemiology, they are going to the epidemiology. I want to give you some little bit of. Okay. Is it this side? Yes. The epidemiology and surveillance. For quarantine, we had 28 in number, and cumulative, we have 34. Self-isolation, we have 5, cumulative 45. Suspected cases, 0, cumulative 0. Contacts traced, 36, cumulative 41. Confirmed cases for number, 0, and cumulative 1. So we have overall, we have 1, and as of yesterday and today, the number of confirmed cases, 0. So the cumulative for meaning we have only 1 case. That is the cumulative, that is 1. Deaths, 0 for number, and then also cumulative 0. So meaning we have no deaths. You will hear a lot of rumors going on, but rely on this information we are giving you. We will share this material with you, but just to give you the summaries. Going to laboratory. Samples collected, 4 were collected, cumulative 13. Sample tested, 3, cumulative 12. Test results available, 4, cumulative 10. Test results pending, 1, cumulative 1. Test results negative, 3, and also cumulative 9. So meaning we have total number of 9 negative cases. Test results positive, 0 for number, 0, and then also for cumulative we still have 1. Test results inconclusive, 0, and also cumulative we also have 0 for that one. Going to the constraints, we have delays in release of funds to train rapid response teams, clinicians and other support staff, and also that one also has been sorted out. Actions have been taken, and then today all those procedures will be sorted out. Funds yet to be committed to a Public Health Emergency Operations Center to adequately reposition to the situation as it unfolds. Standard operating procedures for case management and screening at airport not available as of now, and a lack of real-time data for effective response. That is data gaps in terms of number and type of measures being taken. That is number of people screened at both ground, air, and seaports, number quarantine, and number on self-isolation, etc. The next steps. We are also continuing our contact tracing, monitoring and active case finding, exploring possibility of additional sample kits, PPEs, other operational logistics. Expansion of laboratory testing on national public health laboratory, standard joint operations, strengthen joint operations center, JOC, sea surveillance activity at landing sites, strengthen community awareness activities on COVID-19, and finalization of the public health emergency operation legislation. These are the steps we want to take, and I'm sure by the time we meet again, we'll give an update. And with regards to funds delays, release, and those ones been sorted out, ministers have given a directive, and then discussions have been done with Minister of Finance, and then now all those procedures have been sorted out. And I'm sure by Monday, most of the partners will get their funds. And today, for communication, we are also trying to finalize our posters and everything. And then we are going to bind to make sure all those billboards that were supposed to be requested have been procured on time. So we don't have any barriers in that area now. All those discussions have been done yesterday and day before yesterday between Minister of Health and Minister of Finance, and then it has been sorted out. Because if you know government funds, before it is released, it has to go to certain procedures, and those procedures must be followed. And you cannot bend the rules. You can also take a shortcut. So we have to follow the procurement procedures. We also have to follow the financial instruction, procedures. So all those things must be followed and observed. And that is why perhaps when the money was announced, and then after the time that the money was released, there is a little bit of gap. But like remember, this was I think was Monday. That it was Tuesday it was announced, and then Wednesday, Thursday the procedures have to be followed. And then the PS and other team had to make sure that all those procurement issues have been sorted out. We had the approval from DPPA, and all those things must be sorted out. And then, alhamdulillah, those ones have been done for the procurement and also release of funds for capacity strengthening. Those ones have been sorted out as of now. Thank you.
Thank you very much. That was a very quick update, and almost we have come to the end of the press briefing. Just to highlight some of the points that Director just made. He was giving you some figures as of yesterday. So this data is as of yesterday. We didn't have the data for today yet. So the team here, from here, they're going to meet and gather, as the chairman said. Each and every section is coming to give us an update as far as their operation is concerned. For instance, we have people in the field who are doing the contact tracing, meaning they are following up cases. And then whenever they come across those cases, or those people who have contacts with the index case, then they are going to see how best the person got tested, and then the results would also be given to this committee to put it into what we call daily situational report. And this is the daily situational report we are sharing with you, and we hope that we will continue with this. So he made mention of certain figures which are yesterday, and the cumulative is what has come from day one up to yesterday. So when he said cumulatively 3 tested, as of yesterday, 3 tested negative, and the cumulative number of tests is 9. So this means, as of now, we have 9 that are being tested negative. So we have only 1 pending result, and hopefully by today we will get that one. And if it turns out to be negative, we will also add it to the cumulative number. So this is how things are going, and we have our officers in the